It's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with news on a course that helps to reduce the risk of dementia, right?
That's right, Esther. New guidelines issued by the World Health Organization indicate steps that people can take to reduce the risk of dementia. Dementia is described as a group of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. The condition results from a variety of diseases and injuries that affect the brain, such as Alzheimer's disease or stroke. Dementia affects memory, thinking, orientation, comprehension, learning capacity, language, and judgment. The WHO says there are 50 million people worldwide currently with dementia, and this number is set to triple by 2050. The WHO says the new guidelines provide the knowledge base for healthcare providers to advise patients on what they can do to help prevent cognitive decline and dementia.
This rise in global numbers of people with dementia and the burden of the illness, as well as the fact that currently there is no cure for the illness, makes it extremely important for us to focus our attention on reducing the risk of dementia. And that's where these guidelines are important. So the advice for the general public is that actually what is good for your heart is good for your brain. So a lot of the things that will reduce your risk for cardiovascular disease, for example, heart disease and stroke, will also reduce your risk for dementia. So doing physical activity regularly, eating a healthy and balanced diet, stopping tobacco use, reducing your alcohol consumption, paying attention to your weight, getting your blood pressure, your blood sugar levels and your cholesterol levels monitored and treated if they're raised. All these are things that will actually help you with reducing your risk of dementia later in life.
And the WHO's global action to address dementia also include strengthening information systems for dementia, diagnosis, treatment and care, supporting careers of people with dementia, and research and innovation. The international health body recommends that governments to create national policies and plans for dementia. Now, scientists at the University College London are developing new technology to help doctors detect deadly bowel cancer and polyps in their earliest stages and ensure the best chances of a patient's recovery. The system, called Odin Vision, uses a combination of artificial intelligence and space technology for diagnostic precision. VOA's Latika Hawk reports.
Bowel cancer is the world's third most common type of cancer, and the sooner it is detected, the better chance a patient has to recover. But a doctor performing a diagnostic colonoscopy does not always see everything shown on the screen, and smaller details often go undetected.
We miss about 1 in 5 polyps during colonoscopy, and for the second biggest cause of cancer-related death in the UK, that's a big deal.
Scientists say artificial intelligence can see the entire image. It never looks the wrong way, and it never gets distracted.
As the live video is being streamed, our system takes in that image frame by frame, processes it with what we call an artificial neural network, and tries to identify where those polyps are by looking at things like the patterns of in the images, the different coloration of the tissue.
That data is too big and too detailed to be sent via the internet. So instead, Odin Vision uses the communication between the Earth and satellites millions of miles away, where the AI is stored in a cloud and transmits the information back in real time to the doctors who are making a diagnosis. The development of the new technology is in early stages. If it proves successful, the cloud will be accessible to clinics and hospitals even in rural areas, ensuring that every patient gets the earliest and most accurate diagnosis.
AI is essentially putting us at the point where we can ensure quality of service. So we're in essence democratizing healthcare, because we can make sure that you get the best expert type of diagnostic function everywhere throughout our hospitals.
Odin Vision scientists hope their breakthrough program will save thousands of lives and help patients avoid radical procedures. Bowel cancer survivors hope the new diagnostic technology will be available soon.
Hopefully this piece of software will be introduced, and so that my family can get reassurance quicker that everything is all right or not with my own health.
Odin Vision is planning a clinical pilot study in the next 12 months and expects early versions of the technology to roll out in the next 2 years. Zlatica Hoke, VOA News, Washington.
Laughter is the best medicine. It is a common phrase often found printed on plaques or cards, but the practice of yoga has taken it on a whole new direction over the years. We found a laughter yoga class in Richmond, Virginia. Ali Orozkai reports and VOA's Bezan Hamdard narrates.
A stand-up comedy act? An acting class? No, this is laughter yoga.
I'm a stress magnet, and once a week I get to come in here and act like a nut and laugh and get rid of stress, and it's the best happy hour I've ever had.
Laugh like crazy and reduce stress. That's the idea behind the practice of laughter yoga founded by Indian physician Madan Kataria in 1995. Since then, it has caught on with more than 5,000 laughter yoga clubs worldwide.
1, 2, 3, go for it.
Yoga master Slash Coleman, who founded RVA Laugh Club, was certified through Laughter Yoga University, based in Bangalore, India.
But I lead people through laughter yoga exercises, and that involves different games that we play to move the body in different ways, so we allow oxygen to come into the body in different parts of the lungs.
Coleman established this club after he discovered the benefits of laughter.
And my right lung mysteriously collapsed. I was living in New York City at the time, and I spent a month in the hospital. And after the doctors did 2 surgeries, they said that laughing would help my lung to heal because it would help the lung expand.
Participants come to his class looking to alleviate stress and gain some health benefits.
I just get to be a kid again, it's just silliness and connection. I mean, so much fun. Most days people are kind of grumpy, you work in an office, you see a lot of this, right? But it's nice and light. I enjoy it.
Slash Coleman believes that laughter is also a tool that can bring people together.
Laughter is this universal language, and we are bonding with each other in here from all religious backgrounds. I'm Jewish, and that we've had people, Hindus come in, and people that, Christians and Muslims, and none of that matters.
Laughter yoga is no joke. A technology-ridden world has seemingly contributed to a spike in stress in daily life. Health experts agree that increased stress is one of the primary threats to the day-to-day health, and battling it with laughter and calmness is essential to preserving a healthy body and mind. For Ali Orozkai in Richmond, Virginia, Bezan Hamdard, VOA News.
And that's our health report for today. To stay in touch, find me on Twitter at Linord Moudou. Esther, there you have it, a reason to laugh every day.
No, it makes me laugh. Now, I want to know why you're laughing in the first place.
You know what? For me, I try to take life I try to find humor in everything, right? So I try to keep my laughter at all time, even when it's difficult.
For example, here in the studio, anything that tickled you today?
Anything that happens can make me laugh.
Whether it's the camera lighting or something that
even when you stumble on your script while reading, you can laugh
like
about
my mom.
it.
She had an infectious laughter, and then she would laugh. When we start laughing, she asks you, why are you laughing?
But it's good for you, so that's the takeaway. Laughter is a good medicine.
I think we're going to work on that. Linord, thank you so much for that.
Thank you.
Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, have a good evening and laugh if you can.